When you can't see a GP, where do you go?
It was a summer of protests for the Bitterne WalkIn health service. But the axe has now fallen. Southampton's clinical commissioning group is scrapping the walk-in. Some residents fear the service is closing prematurely. The clinical commissioning group's proposal document reveals concerns from Southampton Council's Health Scrutiny Panel. The panel says there's still a lack of public awareness of and confidence in alternative services like NHS 111. Councillors say closing the walk-in could mean some patients don't access services when they need them, or there may be more pressure on the city's emergency departments. A public consultation shows over 70% of respondents want to keep the facility. So is the walk-in closing before residents have been properly informed of the alternatives?
We are confident, however, that the closure of the walk-in service will not lead to any adverse impact on the emergency department. In fact, over the last couple of years, we've already started to see attendances at the emergency department decreasing. We expect that trend to continue, but of course, we will be monitoring that very closely. As a result of the consideration that we've made this afternoon, though, and looking very closely at what we learned during the course of the consultation, it's clear that we need to ramp up quite substantially our communications plan to ensure that people are aware of things like the Pharmacy First scheme, of the 111 service and the advice and direction towards help that people can get from using 111 in particular, which, despite the adverse publicity that surrounded 111 in other parts of the country, has actually been a very successful service here in Southampton and wider Hampshire.
The public consultation on the walk-in also flags up concerns over GP services. Some residents feel it's difficult to get GP appointments. Declan Clune is one of the campaigners who's been trying to save the walk-in. What does he think will happen in Southampton's GP clinics and hospitals?
Yeah, it doesn't take a genius to work out that the current provision of health services can only reverse. It will only go back. The provisions that they want to provide, they say they're going to provide, the enhanced GP provision doesn't currently exist. And that is for that to exist takes a lot of funding. They keep talking about the decisions regarding this are because of funding. In my opinion, health services will fall away, mainly for people in the east of the city.
The walk-in service costs almost £1.3 million each year. The money will fund community care and community nursing. Health officials say the cash would be better used for the growing number of people with long-term conditions like dementia and diabetes. The money that's being redistributed, do you really think that's enough money to meet the city's health needs?
We could always do with more funding for the NHS. The NHS is under extreme pressure, as is local government and indeed voluntary services across the city and indeed across the country as a whole. I can't say that the money that is available is enough. It's simply what we have available. We have to make the best use of it. We can only play the hand that we've been dealt, and that's our job as responsible custodians of public services.
Health chiefs say the number of patients using the walk-in has fallen in recent years, but campaigners say that's because the opening hours have been reduced. Claudia is a Bitterne resident. She supports the closure in favour of funding other services.
Now, money is tight. Money is tight for everyone, and we've got to make sacrifices. If you ask me, would I spend the money on the needs of a granny or a people who have major illnesses into community nursing, or would I spend the money to treat a cold that somebody could take at the chemist or in other places, then I know that I would actually want to save a granny. The point is that people are not used to using other services. I have only a week ago, I had an excellent experience with the NHS. My son had an asthma attack Friday morning at 8 o'clock. I called my local surgery on the east side. Half an hour later, we were seeing a nurse.
The walk-in is set to go within 6 weeks, but campaigners are lobbying Southampton's Council Health Scrutiny Panel this evening. Protesters say they'll do everything they can to reverse the closure. Dale McEwan, Solent News Now.